test, sensory evoked potential studies measure electrical activity in the brain in response to stimulation of sight, sound, or touch. When the brain is stimulated by sight, sound, or touch, signal travel along the nerve to the brain. There's electrode detect the signal and display them for your doctor to interpret. The test was divided to 3 tests. It is: first, visual evoked response test; second, brainstem auditory evoked response test; and third, somatosensory evoked response test. This is that related. The example is optic neuritis, hearing loss, multiple sclerosis, brainstem tumor, and spinal cord disease. If these symptoms are present in someone, they must undergo this test. The symptom is: first, pain with eye movement; second, feel like can hear but not understand; third, weakness in the arm and leg, clumsiness or wobbliness and difficulty walking; fourth, problem with thinking, learning and planning; fifth, depression and anxiety; sixth, weakness or paralysis of limb; and lastly, back pain. Risk toward patients that take the test: first, severe nearsightedness; second, presence of earwort or inflammation of the middle ear; third, severe hearing impairment; fourth, muscle spasm in the head or neck.
Next, we want to talk about electrode placement.
For the first test is visual evoked response. We have 3 electrodes to attach. First, center of forehead as a ground electrode; second, top of head as a V-in minus; and third, at the above of onion as a V-in plus. After you attach the electrode, apply the self-sticking wrap to hold the electrode. The wrap should be snug but not uncomfortably. Wait 5 to 10 minutes before recording to allow the electrode gel to permeate the skin. You can refer this picture. For the second test is brainstem auditory evoked response. We need to attach 4 electrodes: yellow point as an active electrode, blue point as reference electrode, black point as a grounding electrode, red point as a reference electrode. You can refer this picture to attach. In a BAER test, we have 2 methods or conditions while recording the test. For the first condition is patient setup with a chair. Second, patient setup with a table. The second method is more comfortable than the first because the patient needs to relax while recording to make the result is accurate and nice. The third test is somatosensory evoked response. SSER has a 2-part of test. First, upper extremity SSEP. N9 point recorded from oscillatory ups point, N13 to P14 recorded near C5 spinal process, N20 to P23 scalp potential generated from the thalamocortical radiations. You can refer this picture. For the second part is lower extremity SSEP. LP point recorded from the T12 spinal process, N34 recorded at the cervical spine, P37 to N45 scalp potential reflect activation of the primary somatosensory cortex.
Procedure of test sensory evoked response. Number 1 is visual evoked response. Step 1 is the VEP will take approximately 30 minutes to complete. The technologies will begin by measuring the propagation, heat, and marking electrode position with a non-toxic, washable marker. Step 2, the technologies will then test the patient's eyesight. Step 3, the result of the test will be interpreted by a specialist and the final report is sent to the ordering physicians. Number 2, brainstem auditory evoked response. Step 1, you will sit in a soundproof room wearing earphones. a healthcare professional will place an electrode on top of your head and on one earlobe and then the others. Step 3. A clicking sound or another auditory stimulus will be delivered to the earphones to the being tested, while a masking noise will be sent to the other ear to shield it from the stimulus. Number 3 is somatosensory evoked response. Step 1. A healthcare professional will place an electrode on the scalp and at one or more locations on your body, such as the wrist, back of the knee, or the lower back. Step 2. Small, painless electrical shock will be delivered to the electrode placed on the body. Step 3. For each of the tests, the electrical activity detected by the electrode on the scalp will be fed into a recorder amplifies the signal and charge it so that your doctor can interpret the results.
The result of 3 types in evoked potential. The first one is visual evoked potential. The pattern on VEP usually includes a positive component at about 80 milliseconds and a large negative component at about 110 milliseconds. Second is brainstem auditory. A wave of decreased air pressure and the movement of the tympanic membrane and of trachea in the inner ear are the opposite of those produced by compression clicks. The third one is somatosensory. There are several other processes represented by the fraction N13, P14, N18, N20, N22, and P37 where they act as a result of processing from food stimuli.